Hey, you guys, welcome to day 6 of our March Madness practice questions. If you haven't had a moment, go check out the first few days that we have covered. We'll be doing this all month long, but let's get into our practice questions for today. As always, I like to give my disclaimer before getting into any of my content or resources. But for those of you who are familiar with me, hey y'all. For those of you who are new to me or the channel, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources and tools and courses and videos to assist nurses and nurse practitioners with being successful on boards as well as in practice, okay? But I like to give the disclaimer just to state that, everything in medicine, there's no absolutes. We treat on a patient by patient basis, and I provide these questions and content based on the guidelines that are currently being tested. Okay, so keep that in mind and let's get into the questions. All right, question number one. Question number one states a patient presents to the office for follow-up. He has a history of anemia. The nurse practitioner is reviewing the patient's labs with a hemoglobin and hematocrit that are below normal, MCV 118, MCHC 33, and neurologic deficits are noted on exam. Based on these findings, how should the nurse practitioner diagnose? Is it A, iron deficiency anemia, B, thalassemia, C, B12 deficiency anemia, or D, folate deficiency anemia? Take a moment and tell me what you think in the comments. Tell me what you think. All right, I always tell you guys to read the stem of the question first to slow yourself down and ensure that you're answering what they're even asking of you. So the stem of the question states, based on these findings, how should the nurse practitioner diagnose? So, all right, what do we have going on that we're diagnosing? This patient's in for follow-up, has a history of anemia, hemoglobin and hematocrit are low, anemia, correct. MCV 118, MCHC is 33. Neurologic deficits based on exam. All right, so we're trying to figure out what type of anemia this patient may have. Looking at the MCV and MCHC, so MCV is looking at cytic, the cytic ending, and so that would be macrocytic because it's 118, right? So if it exceeds 100, the MCV greater than 100 is macrocytic, right? Less than 80 is microcytic. Anywhere in between 80 to 100, normalcytic, right? And then MCHC is looking at chromic. 33, that's normal chromic, right? Because if it's less than 31, it's hypochromic. If it's anywhere from 31 to 30, it's 31 to 37, it is normal chromic. If it exceeds 37, it's hyperchromic. So here it's macrocytic normochromic. So I want you to think about the anemias. If you have not looked at my anemia video, go check it out. I like to talk about the 2-1-2 rule with the 5 common anemias. Your IDA, your thalassemia, your anemia of chronic disease, your B12 deficiency, and your folate deficiency anemia. Because there's 2 that falls in that smaller range, right? So 2, and that's your IDA and thalassemia. So we can eliminate these because we're in the macrocytic and not micro. So those 2 in that microcytic hypochromic area are the IDA and thalassemia. The ones that fall in the normocytic normochromic is 1 on my 2-1-2 rule. That is your anemia of chronic disease. And then I have 2 in the lower scale. So the higher number. So we have 2, 1, 2. And then in the higher scale, that's your macrocytic normochromic. And those are your B12 deficiency anemia and your folate deficiency anemia, right? So we can cut this down to C and D. Now, how do you differentiate between the 2? Well, with B12 deficiency anemia, they have neurologic deficits. They may present with a beefy red tongue. So just paying attention to those key identifiers. So here it does mention neurologic deficits. The answer is C, B12 deficiency anemia. All right. So let's get into question number 2. The nurse practitioner is explaining the mini mental status exam to the nurse practitioner student. All of the following show proper understanding of what is included on the mini mental status exam except A, count backwards from 100 by 7. B, earlier I mentioned three words to you. Repeat those back to me. C, what is the year? D, how many fingers am I holding up? Take a moment and tell me what you think in the comments. All right. So, stem of the question states, all of the following show proper understanding of what is included on the mini mental status exam except. Is it A, count backwards from 100 by 7? B, earlier I mentioned three words to you. Repeat those back to me. C, what is the year? Or D, how many fingers am I holding up? So A, count backwards from 100 by 7. Yes, that's on the mini mental. B, earlier I mentioned three words to you. Repeat those back. Yep, that's on there. C, what is the year? That's on there as well. So the answer is D, because that is not included in the mini mental status exam. Don't miss that it says except. So which one is not on there, okay? D is your best answer. All right. And lastly, for today, question number 3 states, a patient presents to the office with complaints of pain to her right wrist. She states that she fell yesterday morning, and as she was attempting to support herself while falling, she injured her wrist. On exam, there is noted swelling. What is the next best step by the nurse practitioner? A, x-ray her wrist to assess for fracture. B, MRI her wrist. C, follow up in 1 week with an x-ray. Or D, nothing, it will resolve on its own. Tell me what you think in the comments. All right, stem of the question states, on exam, there is noted swelling. What is the next best steps by the nurse practitioner? All right, so the patient comes in. She's complaining that she has right wrist pain. She states she fell yesterday. She supported her fall and injured her wrist while doing so. There is some swelling. What do we do next? And your best answer here would be C, to follow up in 1 week with an x-ray. I know that might sound crazy, but this is classic presentation of a potential navicular fracture. Typically, someone falling, they're trying to support their fall. You know, you extend your arms to catch yourself to brace that fall, and injuring that wrist, and you injure that scaphoid or fracture that scaphoid bone. And with that, it will not show until at least a week after the actual injury. So you bring them back in 1 week and do an x-ray to confirm the diagnosis. So C is your best answer. All right, you guys, that's it for today. But as always, be sure that you like, comment, and subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here for more videos and more practice questions all month long. If you are looking for resources, one-on-one sessions with me, if you want to do any of our review courses, we have self-paced. There are group resources, review books, etc. Just reach out to the nursing studio. You can give us a call at 803-400-6864 or shoot us an email at thenursingstudio, the number 1 at gmail.com. Let me be back here. Bye, y'all.